Hey guys, welcome back. In this video, we're going to talk about thrombosis. But before we directly jump into the disorder, let's see the normal process or hemostasis first. Hemostasis is the maintenance of the clot-free state of blood and the prevention of blood loss via the formation of hemostatic plaque, and it depends on three general components, which are vascular wall, platelets, and coagulation pathways. Whenever a vessel is ruptured or injured, hemostasis is activated by four stages, and these are vascular spasm, formation of platelet plaque or primary hemostasis, formation of blood clot as a result of blood coagulation or secondary hemostasis, and eventual growth of fibrous tissue in the blood clot to close the hole in the vessel permanently. We will talk about these processes on separate video. When it comes to the disorder or thrombosis, under this topic we will discuss the definition, the pathogenesis, the morphology, the fates, and the clinical significance of thrombi. Thrombosis is defined as the formation of a solid or semi-solid mass from the constituent of blood within the vascular system during life, and there are three factors that predispose to thrombus formation, and these factors are called Virchow's triad, and it includes endothelial injury, stasis or turbulence of blood flow or alteration of blood flow, and blood hypercoagulability. And these factors are interrelated. A disorder in one can lead to the disorder in the next or in the second. For example, hypertension causes turbulence, which might also lead to endothelial injury as well. When it comes to the first factor or endothelial injury, it's the most important factor in the thrombus formation, and by itself it can also lead to thrombosis. Endothelial injury is particularly important in the thrombus formation in the heart and arterial circulation. For example, injury over ulcerated plaque in severely atherosclerotic arteries, or in hemodynamic stresses like severe hypertension and turbulence of blood flow over scarred vessels directly damage the endothelium. Bacterial endotoxin and smoking might also be source of endothelial injury. Irrespective of endothelial damage, the final event is exposure of the highly thrombogenic subendothelial extracellular matrix, mainly collagen tissue factors, upon which platelets undergo adhesion and contact activation. The second factor is turbulence or stasis or alteration in normal blood flow. Under physiologic conditions, normal blood flow is laminar, that is, the cellular elements flow centrally in the vessel lumen, separated from the endothelium by a slowly moving clear zone of plasma. Therefore, stasis and thrombosis disrupt the laminar flow and bring platelet in contact with endothelium. They also prevent dilution of activated clotting factor by freshly flowing blood, and they also retard or make a time lag in the inflow of clotting factor inhibitors and permit the buildup of thrombi. And stasis is a major factor in development of venous thrombosis, while the turbulence contributes to arterial and cardiac thrombosis by causing direct endothelial injury or by forming countercurrents and local pocket of stasis. For example, ulcerated atherosclerotic plaque, which forms a sort of irregularity on endothelial surface, not only exposes subendothelial extracellular matrix, but also it becomes source of local turbulence. Aneurysm also are favored site of stasis. Myocardial infarction not only have endothelial injury but also have a region of non-contractile myocardia, which creates an area of stasis resulting in mural thrombi formation. Mitral valve stenosis after chronic rheumatic fever may also result in left atrial dilation, usually associated with atrial fibrillation, and a dilated left atrium is a site of stasis and prime location of thrombus development. The third factor is hypercoagulability, and it's an alteration of the coagulation pathway that predisposes to thrombosis. And hypercoagulability is a less common cause of thrombosis, and it can be divided into primary or genetic and secondary or acquired causes, which in turn can be categorized into high risk for hypercoagulability and low risk for hypercoagulability. High risk includes prolonged bed rest or immobilization, myocardial infarction, tissue damage in surgery, fracture or burns, or the the low risk factor might be atrial fibrillation, cardiomyopathy, and oral contraceptive use. When it comes to the type of thrombosis, there are 4 types. There is cardiac thrombi, there is arterial thrombi, there is venous thrombi, and there is capillary thrombi. Cardiac thrombi can be caused by infective endocarditis or atrial fibrillation or myocardial infarction, and they are more common in atrial appendages, especially in the right atrium and on mitral and aortic valves. This type of thrombi is called vegetation, which may be also seen in infective endocarditis and non-bacterial thrombotic endocarditis. A thrombus developed in the atrium of patients with atrial fibrillation and dilation caused by mitral stenosis. Myocardial infarction also causes dyskinetic myocardial contraction and damages the endothelium, which usually result in mural or non-occlusive thrombi in the ventricles. But rarely large round thrombus may form and obstruct the mitral valves, and this type of thrombosis called ball valve thrombosis. And there is also agonal thrombus, which is formed shortly before death and may occur in either or both ventricles. And this type of thrombi are composed of mainly fibrin. And this type of thrombi may embolize to any tissue, but they commonly embolize into brain, kidney, and spleen due to their large volume of blood flow to this organ. The other type of thrombi is venous thrombosis or phlebothrombosis. Venous thrombosis affects vein of lower extremity in 90% of cases, and it can be divided into superficial and deep vein thrombosis. The superficial vein thrombosis usually occur in savannous vein system, and particularly when there is varicose. They rarely embolize. They cause local edema, pain, and tenderness, which means they are symptomatic, and local edema due to impaired venous drainage predispose the involved overlying skin to infection after slight trauma, leading to a condition known as varicose ulcer. And the deep vein thrombosis or DVT may embolize, so they are more serious. They usually start in deep vein within the calf muscles around popliteal region. Also, they might cause local pain and edema. Unlike superficial venous thrombosis, they are entirely asymptomatic in approximately 50% of patients. This is because deep venous obstruction is rapidly offset or relieved by collateral bypass channels. And deep vein thrombosis has various predisposing factors. There is trauma, surgery, burn, which result in reduced physical activity leading to stasis, and also injury to vessels. There is also pregnancy state, which increase coagulation factor and reduce synthesis of anti-thrombotic substances. There is also myocardial infarction and heart failure, which causes venous stasis to the left side. There is malnutrition, debilitating condition, and wasting diseases such as cancer. And DVT due to or deep vein thrombosis due to these conditions is known as marantic thrombosis. There is also inflammation of veins or thrombophlebitis, which can also predispose to thrombosis. And migratory thrombophlebitis is a condition that affects various veins throughout the body, and sometimes it's associated with cancer, particularly pancreatic cancer. And migratory thrombophlebitis is known as Trousseau syndrome. When it comes to the arterial thrombosis, the rapid flow of arterial blood prevents the occurrence of thrombosis unless the vessel is abnormal. And atheroma is by far the commonest predisposing lesion for arterial thrombosis. Atheromatous plaque produces turbulence and may also ulcerate and cause endothelial injury, both of which can lead to thrombosis. And these thrombi may narrow or occlude the lumen of arteries such as coronary and cerebral arteries. And occlusion of these arteries will lead to myocardial infarction and cerebral infarction. The fourth type of thrombi is capillary thrombi. Capillary thrombi is minute thrombi composed of mainly of packed RBCs formed in capillary in acute inflammatory lesion, vasculitis, and disseminated intravascular coagulation or DIC. Thanks for watching. In the next video, we're going to talk about the morphology, fate, and clinical presentation of thrombosis. If you like this video, please give it a thumbs up and subscribe for more. You can also check my other videos too.